Australian researchers are about to conduct a study on taming aggressive behaviour in teenage boys. Using eye contact, the behavioural therapy aims to teach teens how to read emotions in other people's eyes, reducing their own anger and aggression. Wow.
So, just how effective is this particular technique, and how else can we use body language to diffuse difficult situations? Let's ask a body language expert, Dr. Louise Mahler. Good morning to you, Louise. Nice to see you. Welcome to the show. What do you make of this new study particularly?
Well, I think it's fantastic that now we're moving away from that area of words that we focused on and moving into non-verbal studies, and there's just such a wealth of information that we can work on.
OK, well, generally speaking, how important is eye contact?
Eye contact is critically important. So, you know, the eyes are the mirror to the soul. You know, they're important for at least 3 reasons. One is we've looked at eye contact because of the way that we are perceived to be either trustworthy or otherwise. But now what they're showing is that, you know, here's a reality. If you don't actually look at people, you can't actually see what they're doing or thinking, and you're getting so much more information. And the third area is that more than that, actually eye contact is a discipline, and so by using that discipline, you're actually looking, and now they're showing with this research, it's altering your brainwaves.
There are different reasons that people cannot make eye contact, and one of different ends of the scale. Someone could be shy, for instance. It could be intimidating to look at someone in the eye. The other one, like right at the other end, is that they're telling a lie or trying to get out of a situation. So how do you judge where they're at and why they're not making eye contact?
We make so many perceptions about why people don't look at us in the eye, but actually it's all about learning preferences. And we tend to, when we have visual thoughts, we look up. When we think of sounds, we look sideways. When we become emotional, we look down, or internal chatter. And not only do we look up, sideways and down, but we look to different sides. And 80% of people follow the pattern where they look to the left for remembered thoughts and to the right for created thoughts. But general public don't know that, so all they know is that if you look away, they perceive deception and they perceive shyness, but actually it's habitual pattern because of our learning preferences.
Okay.
Too much eye contact can be intimidating. If someone's like,
how you doing?
Staring at you, or bearing down on you. That's true too, isn't it?
Well, I think that's the Julie Bishop, isn't it? So, you know, they say she could outstare a gnome, a garden gnome. There's no such thing as too much eye contact. The trick is to actually soften the eyes, and the way to soften the eyes is actually with movement. So there's movement of the head, you can nod, there's a smile, you can lift, but the major way to soften eye contact is blinking, and they've researched and they've shown that actually it's 15 blinks a minute, or a blink every 4 seconds. That will not give the impression of staring.
See, I'm finding this very difficult to have this conversation about eye contact, because I feel now that I'm either staring or looking away.
You have a raft of eye manoeuvres.
So most people do.
I can tell, like when you're...
Most people do, though.
And see, so when Kylie's got what I like to call a soft eye, or an SE,
right,
I'm happy to engage, but sometimes when she's got a CE, or a cranky eye, I don't want to engage. Is that fair enough?
Yes, absolutely.
Yeah.
And, you know, I think that the smile, the research on smiles shows that the real smile actually lifts the muscles under the eyes. So you can tell the cranky eye is when there's no blinking and the muscles under the eyes aren't lifted.
Yeah, and all the blood vessels
that's
are
a
popping
bad
in your eyes.
sign.
Oh, really? We mentioned earlier that... We mentioned earlier that 70%... I'm giving you some non-verbal here communication right now. We mentioned earlier that 70% of our communication is non-verbal, such as... I just demonstrated to Larry. What other body language techniques can we use to negotiate tense and difficult situations?
Yes, well, apart from the eyes, there's actually the body. And, you know, in tense situations, we tend to, you know, reflect. We curve over our body, or we jam our neck like that, which gives us a vocal tone. We throw our head off. You know, so our body needs to actually line up in tense situations to give us a neutrality. Secondly, we need to actually look at the eye contact. We need to have the air that flows. So under stressful situations, we hold our breath, and I think that that's evident in our Prime Minister, Tony Abbott, who holds his breath. So it's the body, the eyes, the breath, and then having done all of those things, then what actually leads the eye are the hands. So, you know, we can gesture things up in that visual area, the auditory area, the future, the past, the present, you know, use the hands to guide the eyes. And lastly, the voice. You know, all of these things actually lead to the voice. And under stress, we go high, or we shake, or we go low, or we do weird things with the voice, and to become aware of that.
How hard is it to master? And the reason I ask you, because we were talking in the commercial break, some of the greatest corporate leaders in the world can't do this. We talk about political leaders around the world. You just mentioned a couple who can't do this either. How hard is it for a normal person to pick this up and get better at it?
Beautifully delivered.
You know, people...
Thank you.
People are always asking, how long does it take to make a change? Well, the answer is, how long would you like it to take? You know, research has actually shown that it only takes 2 minutes to make the change. And that, for instance, with eye contact, if you actually begin to practice eye contact and you do it for 2 minutes, you break through the pain barrier and can change the habitual pattern.